Hi, my name is Dr. Anita Afzali. I'm a gastroenterologist and I practice here at the University of Cincinnati. I am going to talk in the next few minutes about CAM, or complementary and alternative medicine. First, I'd like to define complementary, which is when a healthcare approach is used together with conventional medications. And then alternative is when a healthcare approach is used in place of conventional medicines. So patients with inflammatory bowel disease, we know that the use of CAM has been reported to be anywhere from 20 to 60%. And motivations regarding why one is using CAM, it could include perhaps concerns related to already FDA-approved therapies, or potential concerns related to the side effects of these therapies, or maybe an inadequate response to the prescribed medications. Now, notably, less than half of patients actually report to their healthcare providers that they are using CAM as a potential, either again, in addition or in place of their prescribed therapies, mostly for fear of a negative response from their healthcare providers. Now, the most commonly used CAMs include probiotics, herbs and herbal supplementations, vitamins, fish oil, as well as mind-body techniques. Some suggested possible mechanisms of why or how CAM may work in inflammatory bowel disease is that potentially it downregulates the amount of inflammation, the inflammatory surge of cytokines and proteins that's potentially related to or attributed to inflammatory bowel disease. And so some commonly used medications include wormwood, cannabis, curcumin, myrrh, chamomile and coffee, charcoal supplements, as well as desert Indian wheat. And many of these studies that have evaluated these different herbal medications, they're oftentimes too small in size with the number of patients that were actually enrolled. And also it was limited with the fact that it was not a placebo control. So there is mixed results and related to the results of these studies as far as its utility or positive results potentially in inflammatory bowel disease. One CAM that is commonly and perhaps the most commonly used CAM is the use of cannabis. One study shows that anywhere 10 up to 12%, if not more, of IBD patients are using marijuana for appetite control, for pain control, for management of their diarrhea as well. And also this study suggests that up to even about 50% of patients who are currently non-users of cannabis would actually be interested in the use of cannabis should it become legal in their respective states. Now, overall, although the use of cannabis in inflammatory bowel disease may be associated and has demonstrated to have some improvement in symptoms, what has not been found, and no good evidence yet, has demonstrated that the use of cannabis is positively impacts or affects the actual clinical course of the disease, neither an improvement in biomarkers and achieving clinical response or remission. And in fact, there may actually be additional concerns related to cannabis use, such as cannabinoid hyperemesis syndrome, which is basically when there's an increase of nausea, vomiting, and even pain related to the overuse of cannabis. Whipworm is another CAM that in 2017, after a placebo-controlled randomized trial was conducted, was actually found that there was no additional benefit with the use of whipworm compared to placebo. So that's another CAM that has been previously evaluated and unfortunately has not been found to be very effective. Next, as far as probiotics, this perhaps may be the most promising, particularly in ulcerative colitis. However, other forms of diet or dietary supplements have insufficient evidence. Of note, recently the results from the Crohn's disease multi-center randomized diet study that that compared the specific carbohydrate diet to the Mediterranean diet, found no differences between the two diets in induction of remission for Crohn's disease. So this was a very valuable nutrition study that I think we are placing and putting into practice and discussing with our patients as well. Last, mindfulness and meditation, as well as exercise, perhaps shows the greatest promise, knowing that we understand that there is certainly a strong relationship between stress and inflammation. So with that, I thank you for your attention, and I encourage you to discuss the use of CAM with your healthcare providers. Thank you.